Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. More vaccines arrive Nigeria's shores, the Oxford AstraZeneca brand, as the country battles a third wave of the pandemic. Edo Christian Association of Nigeria says state governments should consider churches to serve as vaccination centers. And COVID-19 booster shots, the US to recommend 8 months after vaccination. Lagos State has recorded another high after the Nigeria Center for Disease Control (NCDC) announced more cases last night. 201 new infections, putting the total figure in Lagos at 68,663, while almost 10,000 people are on admission. River State is next with almost 1,000 cases, followed by Akwa Ibom, 777 cases on admission. 14 other states made up the 584 cases recorded across the country and 4 deaths due to COVID-19 complications. Let's take a look at the update.
The prevention of a further transmission of the Delta variant depends largely on adherence to public health and social measures. The Nigeria Center for Disease Control is asking Nigerians to remain cautious by obeying all precautionary measures as advised as they engage in their daily activities. Nigeria has seen a rise in its daily case count within the last 24 hours as the NCDC announced 584 new coronavirus infections recorded in 14 states and the Federal Capital Territory, indicating an increase by 43 from the figures reported earlier. Lagos recorded the highest number of cases with 201 infections, followed by Rivers with 149 infections. 82 cases were recorded in the FCT. Ondo had 73, Ekiti 17, Cross River 13, while Oyo reported 11 infections. 9 cases were registered in Ogun, 8 cases were reported in Delta and Osun states. 4 cases were reported in Bayelsa and Kaduna states. Kano and Kwara reported 2 cases each, while Sokoto registered 1 case. There were 0 cases reported from Kano, Nasarawa and Plateau states. The overall count of confirmed cases in Nigeria now stands at 183,087. 178 people have been discharged in the last 24 hours, increasing the total number of recoveries to 167,310. The NCDC says 4 persons have died from COVID-19 causes within the last 24 hours, raising the fatality toll to 2,223. Presently, the active cases in Nigeria have exceeded 13,000, while over 2.6 million samples have been tested so far. In Africa, there are over 7.3 million confirmed cases and more than 184,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 207 million, while more than 4.3 million deaths have been reported.
The federal government has received another batch of the Oxford AstraZeneca COVID-19 vaccine, almost 700,000 doses. The vaccines were donated by the United Kingdom government. The executive director of the National Primary Healthcare Development Agency says it will be for those who already had their first jab. The WHO country representative also stresses the importance of prioritizing all who had earlier taken the first dose.
During a brief ceremony at the National Ultrasound Cold Store in Abuja, the acting British High Commissioner officially hands over 699,760 doses of the AstraZeneca vaccines to the federal government. Addressing journalists after the ceremony, the British High Commissioner says the vaccines are part of the 80 million doses pledged by the British government to support COVID-19 eradication efforts in poorer countries.
We remain absolutely committed to ensuring that COVAX reaches its target of securing over 1 billion doses for the most vulnerable people around the world. We do it because we want to be a force for good and because we need a global solution to a global pandemic.
Over 2 million people who took the first jab of AstraZeneca in Nigeria are yet to receive their second dose. The government says these categories of people will be given priority.
This vaccine will be deployed immediately to the states and will be administered as soon as the second dose to those who had earlier received only their first dose of the vaccine during the first phase of nation rollout. I therefore enjoin all those who have received AstraZeneca as first dose to visit the nearest vaccination site to receive the second dose to be assured of full protection.
According to the British High Commissioner, the vaccines are expected to expire by the end of September. Meanwhile, the WHO country representative in Nigeria insists they are safe.
The vaccine is valid through until the end of September. And part of our negotiation with the federal government of Nigeria and with Dr. Faisal and his team was about whether the vaccine could reasonably be used in that timescale, because clearly it's to neither of our advantage for the vaccine not to be used.
AstraZeneca vaccine, Moderna, Pfizer and others are safe. So I encourage all to take the vaccine. Myself speaking to you, I took AstraZeneca.
Nigeria flagged off the second phase of the COVID-19 vaccination on Monday, with high expectation from the government that more people will get vaccinated against the deadly virus.
The Christian Association of Nigeria, Edo State chapter, believes that the church can get more involved in the fight against the coronavirus pandemic and also functioning as vaccination centers. The CAN chairman in the state, Bishop Onyenure Kure, who said this during an interactive session in Edo State, and this is with the Edo State COVID-19 response team in Benin City, adds that the church is already carrying out awareness campaigns urging members to get their COVID-19 vaccines, which they believe is in the best interest of everyone.
Government have discussed with the leaders of the church, and we are counseling everyone to cooperate so that we can save lives, so that everyone that in the various churches can be vaccinated. The vaccine will not kill you. It will rather save you. It will protect you. And so we are in full support that the vaccine should be done in our various churches. It is not a risk. You will not die when you take it. It will rather protect you.
Professor Titus Ibukwe is a healthcare practitioner, a dedicated ear, nose and throat surgeon, ENT. He joins us now virtually. Thank you for joining us on the program, Professor Ibukwe.
Thank you, Millicent, for having me.
All right. Now, the federal government has started the second phase of the national vaccination program. Do you see this batches of vaccines aiding the country's efforts to stemming the third wave of infections? Professor, if you can hear me, just to go over the question again, and this is with the batches of vaccines that we're getting, do you see it aiding the government in stemming and battling the third wave of COVID-19? Appear to be having some audio hitches there with the professor. Hopefully we'll try to connect with him, but then let's tell you what's happening, and this is in Gusau, the Zamfara state capital. Residents there are calling on the state government to intensify efforts in sensitizing the citizens on the Delta variant. Speaking with Channels Television in the state capital, some of them lamented the lack of awareness campaign by the state government, as they believe that public enlightenment, especially to people living in the rural communities, will prevent the spread in the state. Nigeria has witnessed a rising number of cases in spite of vaccination efforts as the highly contagious strains of COVID-19 continues to spread across the state. A major cause is the neglect of public health measures, which is noticeable in major local government areas in Zamfara State, where residents are seen moving about without adhering to the precautionary measures. For some residents, it's a collective responsibility for all to curb the spread of COVID-19.
They should make sure they always use their face masks, always give social distances and limit the number of people they invite in their occasion. And the government needs to educate its people, especially those people living in the rural areas.
My call to the government is for them to make necessary awareness, because like those who are in the remote, they are not aware, so they should create awareness for them so that they'll be able to know what are the necessary precautions to take to stop the prevention of COVID-19.
There's also the call for more awareness by the government for those in rural communities.
Government should actively take measures to create awareness using media, using posters, using religious and community leaders to create awareness, to enlighten their people.
The state government says it is working with the Presidential Steering Committee on COVID-19 to prepare for any eventualities.
His Excellency, the Executive Governor of Zamfara State, Honorable Dr. Bello Mohammed Mutawalla Maradun, was in Abuja and had a meeting with the National Chairman of COVID-19 prevention in the country, who doubles as the Secretary to the Government of the Federation, and they discussed on further modalities and steps to be taken to ensure that the COVID-19, the new variant of the COVID-19 virus, are taken care of.
While a significant proportion of Nigeria's population remains unvaccinated, a heightened surveillance, among other strategies, remains necessary to rapidly identify the prevalence of the variants and stem its transmission. And I'm just Professor Titus Ibikwe has since joined us. Thank you for joining us again.
Thank you, Millicent.
Okay, great, you can hear me. So I was asking, the second phase vaccination has started. Will this stem the third wave in the country?
Yeah, it's a very meaningful measure, and it's something that should be taken very seriously. Right now, it is the only thing that we know that is a sure way out of this quagmire. Apart from ensuring that preventative measures is taken very seriously by each and every one of us, vaccination is the sure way out. And worldwide, that is the way to go. So I am very delighted that a lot of doses are coming in, and indeed, quality brands of the vaccine is entering into the country. So those who have had their first doses and are waiting for the second doses should hastily go and complete their doses, while those who have not received should also do the same. It is actually the way out. For now, there's no better means of handling this problem. The wave will continue to be a recurrent thing until this viral infection settles out. We're able to break the chain of infection.
Professor Ibikwe, we're also hearing a lot of people saying we need more clinical pharmacists, community pharmacists to join in to help vaccinate. And we're hearing CAN saying, let's have churches as vaccination centers. We also recently heard the NCDC Director General say that health workers are the one who would play the next important role in this response. Are you optimistic, especially making sure that some of these vaccines get to the rural communities?
Yeah, I think that has to be applied, because we really need to be able to reach, even hard to reach areas this time, to have the wherewithal to be able to do this. The Johnson & Johnson single dose should be for hard to reach areas, so that once you're able to give a dose to any person in such places, you wouldn't bother seeking for, coming back for a second. We really need a concerted effort to be able to achieve this, to use all available, give them the basic training, as has been done during the. We should be able to recruit and train more people so that end users will be very seamless and very easy. The whole target should be to vaccinate as many as who are qualified to have this vaccine. Our target was have 100% of such people.
Thank you so much. We appear to be having some audio issues, but we would like to thank you for joining us, and hopefully you can join us again when it's really clear. Thank you so much, Professor Titus Abikwe, ENT surgeon. Thank you for joining us again.
Thank you, Millicent.
Still to come on the program, South Africa to manufacture PCR test kits to tackle the third wave. That's in a moment. Welcome back. The South African Health Products Regulatory Authority has authorized local biotechnology company Cape Bio to manufacture a rapid COVID-19 polymerase chain reaction, that's PCR test kits. Announcing the development, Science and Innovation Minister, Dr. Blade Nzimande, said the COVID-19 test kits co-developed by Cape Bio and the Council for Scientific and Industrial Research is expected to help reduce South Africa's reliance on imports, making it easier for the country and the rest of the continent to gain speedy access to test kits. The minister said that as the highly infectious Delta variant continues to drive South Africa's third wave of infections, testing has become increasingly important. The United States continues to battle increased numbers of COVID-19 cases, but politics is getting in the way of ending the surge. Our Washington correspondent, Maria Bird, has the latest.
I know there are a lot of people out there trying to turn a public safety measure, that is children wearing masks in school so they can be safe, into a political dispute. And that this isn't about politics. It's about keeping our children safe.
U.S. President Joe Biden takes on the issue of masking students as U.S. schools begin to reopen and rates of hospitalization of children due to COVID-19 continue to escalate.
So best way to keep our schools safe, and we know how to do it, is to vaccinate everyone who can be vaccinated, vaccinate family members if children cannot yet be vaccinated, and then to follow the mitigation strategies in our school guidance, including masking in schools.
CDC director has stated several times this pandemic is of the unvaccinated, which is why U.S. military is proposing a vaccination mandate for a military force that is currently only 50% vaccinated.
And you can consider this memo today as what we would call in the military a warning order. This is coming, and we want you to be ready for it as well. And obviously, we prefer that that you get the vaccine now and not wait for the mandate.
While the military prepares to enforce policies to increase the number of vaccinated military personnel, immunocompromised Americans have been advised to receive a booster, a third COVID-19 vaccination.
Emerging data show that certain people who are immune compromised, such as people who have had organ transplant and some cancer patients, may not have had an adequate immune response to just 2 doses of the COVID vaccine. To be clear, this is a very small population. We estimate it to be less than 3% of adults.
U.S. COVID-19 hotspots like Florida, Texas, and Georgia continue to be led by the politics of unmasking rights rather than safety and health. From Washington, Maria Bird, Channel Television News.
And Maria joins us now. Hi, Maria. A booster? I suppose there's more than enough vaccines to go around in the U.S., but what's the reaction to this third vaccination?
Good evening. Yes, there is enough vaccinations, to be honest, to go around. Unfortunately, those that are unvaccinated, it's not because of a lack of access to vaccines. It's due to some of the thoughts and some of the nervousness and anxiety around vaccinations of some Americans. And so, yes, there is a third booster that is available now for those who are immune compromised, and they can go and get that at any time. And so the U.S., obviously, as you mentioned before, is not dealing with a vaccine shortage.
For children and masking, what's going on?
Unfortunately, it's become a huge political battle. We know that just if you look at the right to bear arms in the U.S., the U.S. has been a country for a long time that has stood on the values of individual rights. And so, unfortunately, this health crisis that we're in has also became a rights issue. And so many parents are stating that they're mask fatigue, they're COVID fatigue, they don't want their children. And some even have said they just don't believe that COVID-19 is all that the government is making it out to be. And so because of that, this has become a very tense and contentious battle, not only with the governors in those states, but also the parents and community leaders in the various states across the country that have unmasking rules that allow children to be in schools without a mask being worn.
About, states, school heads seem to be going against some governors' plans. Are there fears the Delta variants could escalate in children?
That is the concern. I think that at this time, all the studies are showing and what the physicians are stating is that the Delta variant is much more dangerous to children than the original novel virus of COVID-19. And so that novel virus was one that they were saying was not as much of a risk to children. But as we've seen over the past few weeks, children are entering hospitals and pediatric wards and hospitals are reaching capacity due to the exposure to the Delta variant.
All right, we'd like to thank you, Maria Bird, our Washington correspondent with the latest. Thanks a lot.
Thank you for having me.
And more, we hear that there appears to be, talking about the U.S. now, more cases arising as they're still #1 in confirmed cases and also over 600,000 deaths recorded there. But health officials saying that the administration believes people should get the booster shot, and we're talking 8 months after the initial vaccination. Let's take a look at some of other developments from around the world.
Local media in the United States say officials are planning to announce the administration's decision as early as this week, with the first boosters likely to go to nursing home residents and healthcare workers, followed by older people. Last week, U.S. regulators authorized a third dose of COVID-19 vaccines by Pfizer Incorporated and its German partner BioNTech SE and Moderna Incorporated for people with compromised immune systems who are likely to have weaker protection from the two-dose regimens. Italy has begun vaccinating 12 to 18-year-olds against the coronavirus without the need of an appointment. Vaccination centers in Rome began an open-day system for the age group, allowing adolescents to simply turn up, accompanied by parents, and receive their jab. The government has urged regions to prioritize COVID-19 vaccinations for those aged between 12 and 18 in an effort to extend the campaign before schools and sports activities restart in the country. Japan has extended its state of emergency in Tokyo and other regions and announced new measures covering 7 more prefectures to counter a spike in COVID-19 infections that's threatening the medical system. The current state of emergency, the 5th of the pandemic so far, was due to expire on August 31, but will now last until September 12. Tokyo has announced nearly 4,400 cases today, after a record 5,773 on Friday. Finally, New Zealand's Prime Minister Jacinda Ardern has put the nation under strict lockdown after one new community case of coronavirus was reported in the largest city of Auckland, the country's first in 6 months. All of New Zealand will be in lockdown for 3 days from Wednesday, while Auckland and another coastal town that the infected person had also spent time in will be in lockdown for 7 days.
Don't forget, the coronavirus can live on the surface for several hours. Continue to take responsibility, avoid sharing personal items, disinfect frequently, wear a face mask, wash your hands, maintain a distance. We have more updates on our website where you can get a better understanding of the pandemic. Breaking news as well. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Wonka. Stay healthy.